Hi, I'm Dr. David Morris. I'm a plastic surgeon and specifically a craniofacial surgeon. And I see patients for gender affirmation surgery here at the UIC Craniofacial Center. It's one of the oldest established craniofacial centers in the country, having been here for over 70 years. So we have extensive experience taking care of patients with all sorts of facial differences. There are certain characteristic skeletal features that tend to be more masculine. Those are a prominent supraorbital ridge or brow bone, prominent mandibular angle, tending toward a wider face, and also more angular or square appearing chin. A large part of facial feminization surgery is to modify these skeletal features to try to achieve a more feminine appearance with softer, rounder angles and a fuller forehead, higher arched brows, and so on. We provide in-house services in terms of the latest technology that includes cone beam CT scanning, virtual surgical planning, and our own 3D printing lab. So this is where I see patients in clinic. I'm right in front of the UIC Craniofacial Center, which is at 811 South Paulina here in Chicago. And we're right in the middle of the Illinois Medical District, across the street from UI Hospital, where I do surgeries. And this is a convenient place for patients. We have several parking lots, easy parking right around here. In addition, we're very close to public transportation. The pink line stop is right here, and because the L stop is close by, there's easy public transportation from both Midway and O'Hare airports. So this is a typical room where a patient might be seen for an initial consultation. And I also regularly see patients here during the post-operative period for minor procedures like suture removals.
Hello, I'm Sana Taylor, Patient Navigator for the Division of Plastic Surgery at the University of Illinois Hospital and Health Sciences Center. At UI Health, I'll guide your journey from clinic to surgery. Once you complete a visit with a surgeon, I will work with you to collect supportive documentation and assist with transferring your supportive documents to our billing team. They will work with your insurance regarding coverage for your procedure. You can look to me as a liaison between you, your surgeon, nurse, and the surgery center. If you have any questions, feel free to ask me or I will direct them to the correct person.
Hello, my name is Roberto Flores and I'm the administrative nurse here at the Craniofacial Center at the University of Illinois Hospital. I work with Dr. Morris to make sure you are medically ready to undergo your surgery. I will talk to you before your first appointment to go over some of the documentation we will need to make sure your transition from clinic to surgery is smooth. For facial feminization surgery, we need letters of readiness from your mental health provider, your hormone therapist, and eventually medical clearance from your primary care doctor to ensure you can safely proceed with surgery. When I see you at the clinic, we will take pictures and a CT scan to help plan the surgery. I will go over any questions you may have about your surgery from preparation to the recovery process. This includes any letters you may need for work or school. We work with patients from many different backgrounds. Many of our staff, including myself, speak Spanish, and we have access to translation services to help all our patients. No matter how you arrived, we want to make sure you are comfortable when you visit the Craniofacial Center. Please let us know your preferred name and pronouns so we can address you properly. Welcome to the Craniofacial Center, and we hope to see you soon. Bienvenidos al Centro Craniofacial y esperamos verlos pronto.
As we talk about the skeletal differences and the soft tissue differences between masculine and feminine appearing faces, it's important to know that every patient is different. They're unique in their anatomy, and they're also unique in how they see themselves and what are those features that they prioritize to be changed. And so it's important for me to listen to the patient, and they should feel that when they leave here, they have a very individualized plan for their care.